morning. I am delighted to be here. I want to thank you, the organizers, for inviting us. And I have organized this session of fermented food products together with my colleague at the National Cancer Institute, Dr. Sharon Ross. And I hope we will stir some interest about the possible benefits, but there are also some possible adverse events, unwanted events associated with consumption of fermented food. So first I will introduce, I have a disclosure that everything that I will present is my personal opinion and does not represent the National Cancer Institute official position. And I really don't have any conflict of or potential conflict of interest in relation with this presentation. Historical consumption of fermented food, as we had heard a little bit earlier, had started very long ago. And one very early evidence came from the Middle East, where a confluence of pottery, horticulture, and food processing was developing in the 8,000 years BC. And here is a piece of one of these pottery that was used for wine production. So I thought it was interesting to bring it. But really, the fermentation process started probably even before the human history, because it was the natural fermentation. But now, in these days, we also use controlled fermentation to produce the food that we like. Again, the fermentation, we use yeast to produce alcohol from carbohydrates from different sources, rice, grapes. Bacteria such as lactobacillus for producing yogurt, kefir, and other different dairy products. Also, there are some fermented vegetables used. And again, the science of fermentation is known as zymology. Our session today is going to comprise of wine, so beverages that Dr. Sharon Ross from the National Cancer Institute will introduce, the wine, and here is the history. I will talk about dairy products. Dr. Meredith Huller from the Hutchins Institute will talk about fermented meat and poultries. Dr. Pamela Stark-Reed from USDA will talk about fermented vegetables, and Dr. Thomas Wang, also from USDA, is going to talk a little bit about some of the possible mechanisms. I know he has a difficult job, but he's going to talk about all of this. So this is our session today. So I will start with my own presentation, the fermented dairy products that actually, according with the sources I found, started in about 10,000 years BC. But about 100 years ago, Elia Menchnikov observed that the life expectancy of peasants in Bulgaria that were consuming large amount of fermented milk, they were living longer. So is this something that we all want to, just to live longer? So he thought that their high life expectancy was due to the consumption of these fermented milk products. Milk products are produced using lactic acid bacteria as lactobacillus, lactococcus, and leuconostoc. And initially, the fermentation was used just to increase the shelf life, to increase the taste, to improve the digestibility of milk. And some people are lactose intolerant. Apparently, some of those people may tolerate better fermented milk versus regular milk. And we are wondering if indeed Eli Mezhnikov was right and if there are any health benefits associated. So first, I would like to make it clear what are the definitions that I am using for my presentation, and as probiotics were originally framed by World Health Organization and FAO, and it's still the definition broadly accepted, although it's kind of old, is live microorganisms which, when administered in adequate amounts, confer a health benefits on the host. So I want to make 2 points. If we consume dairy products with the aim of getting benefit of the probiotics, the microorganism should be live, and the quantity should be adequate. So not too much, not too little, because there are also some associated adverse events with very high amount of probiotics. If the amount is too low, we don't get a health benefit. But also the microorganism should be live. So we cannot make assumption that anything that we buy as fermented milk products do have the live microorganism. And the prebiotics, as defined, are non-viable food components that confer a health benefits on the host associated with modulation of microbiota. So basically the prebiotics are the one supporting and the probiotics life. And when we have both of them, we have a symbiotic product that's a combination of pre and probiotics. There are a number of fermented dairy products using lactic acid bacteria as cheese, cultured buttermilk, acidophilus milk. So different countries use different fermented dairy products, and as you can tell, most of them are using 1-2% of milk fat, and then the typical shelf life is between 10 days and 2 weeks, so regardless which one it is, excepting the cheese that has a longer shelf life. But again, do not make the assumption that if it's a cheese at the time you're consuming, it really still has the live bacteria, may or may not have. But anyway, what they have in common, all are coming from milk, and for their production, one or another strain of lactic acid bacteria was used. But having different strains, it means that they may possibly have a little bit different properties. So for example, according with some in cell cultures or animal studies, some of the lactic acid bacteria, like Lactobacillus acidophilus, may have apoptosis property, while some others, like Bifidobacterium, could be an antioxidant, but as well, it's also, so Acidophilus could be apoptotic, but also it is also stimulate the dendritic cells to produce inflammatory cytokine. Then could be also immune response improvement, have some epigenetics property, and some anti-cancer function. So again, you see here different strains with a little bit different properties according with what has been studied and their real properties. The aim of consuming or using the prebiotics is to either, if you see with green, the green line is the normal non-perturbed microflora, microbiota in the colon, and with the red one, you see the perturbed microbiota for a different reason. The use of prebiotic has the aim to either reduce the intensity of perturbation or reduce the duration of it. So basically, this is what we're trying to do at this point. Some of the mechanism involved with the probiotic interaction with the intestinal epithelium to achieve the goals that we want are competitive exclusion of pathogenic bacteria, so the interaction between probiotic and pathogenic bacteria, the stimulation of humoral response of the gastric or colon mucosa. Then they may have also a direct antimicrobial activity by decreasing the pH, and I think we've heard yesterday, for example, that certain like H. pylori is growing or not growing according with the pH, but there are so many others pathogens that may or may not grow in a different pH. They enhance the mucosal barrier integrity, release polyamine, and inhibition of the inflammatory response. So generally speaking, these are the mechanisms of probiotic interaction. I'm going to just discuss very briefly two mechanisms, the apoptosis and the immune stimulation, and I will let Dr. Thomas Wang from USDA to talk more about this mechanism. So one of the potential mechanisms, and I am presenting this one because it is related to anti-cancer activity, would be the stimulation of apoptosis to the intrinsic pathway and through the extrinsic pathway. Both goes to, so the extrinsic pathway would go to downregulate NF-kappa B and then go to caspase and induce the apoptosis, and intrinsic pathway in association sometimes with conventional therapy would do the DNA damage and also caspase and apoptosis. And again, Dr. Thomas Wang will present this in detail. I just quickly wanted to mention, and I want to mention also the immune response induced by lactic acid bacteria, and there it is an immune stimulation, immune regulation through increased interleukin 12, and we have the anti-tumor immunofunction that it is not cytotoxic. So we have apoptosis and we have immune stimulation. Now I would like to go through some of cell culture, animal studies, human studies, and see where the actual evidence stays when we talk about probiotic and fermented food consumption. So this is a cell line culture. There were 3 different colon cancer cell lines that were used in these studies, and Bacillus acidolensis has been used, and you can see here that all 3 cell lines responded to this particular bacillus, but it is a dose-response relationship, and as well we see that not all lines have the same response. So they do respond to the Bacillus adolescentis, but dose response relationship and different responses, so each cell line is more or less sensitive to this particular probiotic. Here you can see in this study, I wanted to show that a similar human colon cancer is responding to a different lactobacillus, that Lactobacillus delbrueckii. So we have this cross interaction. So one probiotic may influence more than one type of cancer, and one type of cancer could respond to more than one probiotic. So we have the possibility, we need actually to find which probiotic would be the most effective for a particular type of cancer. Just to show that indeed the probiotic here, Lactobacillus acidophilus, was used in a mixture with Lactobacillus casei in the presence of chemotherapy, 5-fluorouracil. And here we use a live bacteria, and you see it is a dose-response relationship in the percentage of apoptosis. So you see here it's a very, very good response with 5-fluorouracil and high amount of the probiotic. Here, when the probiotic was inactivated, then through the microwave, you can see there is still some response that is due to the actual chemotherapy, but it is modest in comparison to the combination of chemotherapy along with the probiotics. But then after where am I? I don't see it. I don't know what it is. So anyway, after that, we can see that the increasing just the 5-fluorouracil would not give any additional benefit. Yes, thank you. So here we use oral inoculation of probiotic, Lactobacillus acidophilus, that would suppress tumor growth in segmental endotopic colon cancer and extraintestinal tissue. So here it is just the control. Here it is the control. You see the tumor, it is smaller. So it is this one here, it is smaller. And even with E. coli, it is smaller. So the highest was with the highest tumor volume was with control, and the smallest tumor volume was with Lactobacillus acidophilus. We also can see that because I did mention the pro and the prebiotic, I have a slide here to show you that actually the use of probiotics and prebiotics and the combination. So you see that there are invasive carcinoma. Here it is in situ carcinoma and benign lesions. So we have the control, we have the probiotics, and you see the difference in the invasive carcinoma versus the control. And here we have prebiotics, even better. It is not much benefit, but it is a little bit better with the combination. It is better for in situ carcinoma, but not versus probiotics. And for benign lesion, it is very surprising, little bit increase. So what I'm trying to say is that we just cannot assume that any combination of pre or probiotics would immediately give a benefit. Everything has to be really carefully studied because we don't know enough at this point. In a clinical trial that was done using a fermented milk containing 3 probiotic bacteria in patients with irritable bowel syndrome, we can see a beneficial effect looking at the IBS score that lasted for about 8 weeks. It's not very big difference, but it is a difference. But once the administration of probiotics stopped, the effect didn't last and went together. So the effect of probiotic, it's usually lasting for the time that's being administered. When we stop the administration of probiotic, then the effect quickly disappears. There are some publications showing that cultured milk, yogurt, and dairy intake in relation to bladder cancer risk in prospective studies in Swedish women and men show that there is a high intake of cultured milk may lower the developing of bladder cancer. The evidence is kind of weak, it's not very strong evidence, but it is a possibility that the risk of bladder cancer could be eventually reduced by high consumption of cultured milk. And here in the Netherlands cohort study in 1986-2002, you see in women and in men, it a little bit weaker in women, but it is kind of weak evidence. So not too much, but there is a possibility and more room for research. According with EPIC study, the consumption of yogurt intake was significantly inversely associated with colorectal cancer. So I'm just trying to show indeed that not every single cancer could be prevented by the use of fermented milk products. But it is colorectal cancer could be reduced by high intake of yogurt and also high intake of fermented cheese. However, the milk consumption and the risk of prostate cancer, as you can say, is a little bit more on the right. So apparently it is a weak increase in prostate cancer associated with milk consumption. And here I have milk consumption because actually this is not fermented milk, it is milk consumption. So we don't know that if would have been fermented, would look differently, but we do know that is also a weak association of increasing risk of prostate cancer with consumption of calcium. So I don't know what it is, but for milk itself, it looks like it possibly increased a little bit. According with the World Cancer Research and American Institute for Cancer Research report, that the last edition in 2007, there is a probable association between milk intake and lower risk of colorectal cancer. A probable association between milk intake and increased in risk of prostate cancer, and it is some weak association between milk intake and lower risk of bladder cancer. The conclusion is that fermented dairy products show some benefits in preventing certain type of cancer in cell culture, animal studies under specific conditions. So we want to send a message that when we have a result for a specific study, that particular result applies for that particular conditions, how the study was conducted. It cannot apply for any consumption, any condition, any probiotics, any cancer. So it's very specific. There are a few cohorts in clinical trials that show some benefits for colon and bladder cancer related to fermented milk products. But we need more studies to establish the subgroup who would benefit the most, the one at risk, the type of most effective symbiotic, which type of probiotics related to which type of cancer, the amount, the frequency, the duration, because at this point we know that once we stop the consumption, so the effect would not last. And then not only cancer, some other diseases. So I know that IBS, traveler's diarrhea, necrotizing enterocolitis could benefit from consumption of fermented dairy products. I thank you very much for your attention, and if you have questions. If you don't have questions, then because I'm also chairing this. Oh, it's a question.
I saw one of the slides that you did your study using rats, and I want to think you established the cancer in the rats. I was just wondering, how long did it take you to establish the
this
cancer?
One?
No, there was. You said cancer, rats carcinogenesis was the title there.
I am not doing research, so everything I presented is from literature search, but I may be able to answer. I don't know exactly which one.
Depends what kind of model.
Okay. So because we're trying to do a work on cancer, and then we're told that it's very difficult to actually reproduce the cancer lines in sentinel animals. And I saw that in one of your slides.
So
I
if
thought
you
you'd be
if
doing
you
that.
you can inject the cells, or you can induce the cancer with the carcinogens. So it depends which type of cancer you try to
Reproduce.
to induce in animals. So you can either put the cells, or you can use a carcinogen to induce the cancer.